Hi, I am Frankie Hamilton, and I will be discussing my current event paper, Take Care of Maya. I selected this documentary because it presents a complex child welfare case involving medical decision making, family advocacy, and child protective services. Maya was diagnosed with complex regional pain syndrome, or CRPS, which is a chronic pain disorder that can be difficult to diagnose and treat. According to the documentary, Maya experienced improvement after receiving ketamine treatments under the care of a specialist. When her condition worsened, she was hospitalized, and at that time, her mother strongly advocated for care to continue the same treatment plan. However, the members of the medical team became concerned that the mother's insistence on aggressive treatment represented possible medical child abuse, also known as factitious disorder imposed on another, formerly known as Munchausen disorder or Munchausen syndrome. Those concerns resulted in CPS becoming involved. It also resulted in Maya being separated from her family and strict restrictions on the family being able to visit Maya in the hospital, speak with her, or to be a part of the decision-making process of her care. One of the most devastating aspects of this case is that during the investigation, Maya's mother chose to end her own life. After the loss of her mother, Maya was soon able to be reunited with her father and brother and return to the family home. Regardless of where someone stands on the decisions made, this documentary demonstrates how difficult child welfare cases become when professionals must balance child safety, family preservation, and parental rights while working with incomplete or conflicting information. Especially since child welfare professionals often must make decisions when medical evidence is uncertain, and both interventions and non-intervention can carry significant risks. Family systems theory encourages us to evaluate both strengths and challenges rather than focusing solely on the allegations of abuse. Maya's family demonstrated several strengths. They appeared closely connected. Both parents actively advocated for Maya's treatment, and they remained committed to supporting one another and Maya throughout the investigation. It was also apparent that they had financial resources and health insurance that allowed Maya to receive specialized care. At the same time, the family experienced significant challenges. Maya's chronic illness affected everyday life long before CPS became involved. Once abuse allegations were raised, the investigation and separation disrupted family roles, communication, and emotional well-being. This reminds us that child welfare assessments should recognize protective factors while also identifying safety concerns. Because understanding that both protective factors and family stressors create a more complete child welfare assessment. Family systems theory helped me better understand why this case affected every member of the family, not just Maya, and why it was important to include every family member and not just Maya. The theory explains that families operate as interconnected systems. When one member experiences a crisis, the entire family is affected. In Maya's case, her illness changed her family's routines. The CPS investigation altered family roles, and the separation changed relationships between parents, siblings, and with Maya. Rather than viewing Maya as the only client, family system theory encourages social workers to recognize that interventions affect everyone within the family system. This case also demonstrates how support systems can be both beneficial and challenging. The family's strongest and foremost support came from one another. Maya's parents and brother remained emotionally connected despite the separation. Formal supports included physicians, specialists, attorneys, community supporters, and child protective services. An important point that I would like to emphasize is that support systems are not always experienced positively. While healthcare providers and CPS became involved because they believed that Maya might be at risk, the family experienced many of those interventions as stressful and harmful. This illustrates that social workers often work within systems that may simultaneously provide protection while increasing stress for the family that they are trying to help. From a child welfare perspective, I believe there were opportunities that could have strengthened communication and collaboration. Some of the recommended resources that I would suggest would be trauma-informed family counseling and individual counseling, which could have supported the family's emotional needs during the investigation. Care coordination may have improved communication among healthcare providers, mental health professionals, and CPS. Interdisciplinary collaboration is particularly important because child welfare cases often involve multiple professionals, each bringing distinct areas of expertise throughout the ongoing assessment. As a child welfare goal, Croson Tower emphasizes that protecting children and supporting family function should occur together whenever it is safe to do so. This case illustrates how communication between systems can influence both child safety and family outcomes, and that effective child welfare practice depends on communication, collaboration, and family-centered interventions rather than isolated decision-making. In my research, I also included information from an unrelated case from several years before Maya's. Gypsy Rose Blanchard, her mother, Dee Dee Blanchard, fabricated and exaggerated numerous medical conditions over many years, leading to numerous and unnecessary medications, surgeries, and treatments. In Gypsy Rose's case, factitious disorder imposed on another was eventually recognized and confirmed. I included the Gypsy Rose Blanchard case because it provides important context for understanding that medical child abuse is a real form of maltreatment that professionals have an ethical responsibility to investigate, and also why child abuse allegations must be taken seriously. While Maya's case remains disputed, looking at her case alongside Gypsy Rose's case, we must be mindful that failing to identify abuse, making inaccurate conclusions, or false allegations can cause lifelong consequences. Furthermore, it is a reminder that careful assessment must be implemented to help protect children while also minimizing unnecessary trauma to families. This documentary challenged me to think about how my own experiences influence my my professional perspective. As a mother, I found myself relating to Maya's mother's determination to advocate for her child. I also have previous experience in the medical field, like Maya's mother, so I understand why parents sometimes question treatment decisions or advocate strongly for what they believe is best and may be seen as brash. My childhood experiences with CPS also influenced my initial reaction because I did not feel adequately protected when abuse occurred in my home. However, those experiences naturally led me to empathize with families who feel unheard by helping systems. At the same time, my social work education has taught me that effective practice requires looking beyond my personal experiences and considering multiple perspectives, rather than assuming one side was completely right or wrong. As a future social worker, I plan to balance child safety and family preservation, approach families with empathy, collaborate across professional disciplines, base decisions on careful assessment rather than assumptions, and make sure that I'm upholding the NASW Code of Ethics throughout all of my evidence-based practice. These are the resources that inform both my paper and the presentation. I relied on the documentary as my primary source. While Croson Tower provided the child welfare framework, Walters and colleagues explained the complexities of medical child abuse investigations, and the NASA Code of Ethics guided my discussion of professional responsibilities. And finally, the biography article about Gypsy Rose Blanchard provided context for why medical child abuse concerns must be taken seriously.